Okay, no problem, Chase. Thanks for letting us know. Today for the agenda, there isn't much on the, there aren't very many agenda items other than having an opportunity to share for each of the subgroups to share their final recommendations. So that's objectives and strategies that they'll be submitting as a part of this work group. We will likely not need the whole time today. But we have it just in case there's any discussion about if people have from other subgroups have comments on some of the other objectives, and or if there's some final tweaking that we want to end up doing, we can set up some breakout rooms, and the subgroups are welcome to use a little bit of extra time since we're all gathered today. Any questions before we kick things off? The hope is that we can walk out of today with some final objectives, recognizing that there might be some more tweaking that needs to happen. So the goal really is by the end of the day, well, Monday is a holiday, I realize. So by the end of the day, preferably Tuesday, any final comments about the recommendations and final language are submitted so that we can combine everything and have things ready to submit and combine with all of the other work group recommendations by the end of next week, November 15th. The idea is that this will be our last meeting, but in January, there are some plans to invite the work groups back together to share some updates on the progress we've made. I'm good. It looks like Chase is still working on things, and I'm assuming Chase will be sharing the direct care workforce recommendations. But Teresa or Kathy, do you have a preference of who goes first?
No.
Teresa, do you want to kick us off then with the family caregiver recommendations and strategies?
Sure. I'm just going to read from the report we shared with Leslie. And so we are assigned to the Promoting Economic Opportunity Subcommittee, and our subgroup is Family Caregiver, the informal family caregiver. And our objective is strengthen Maryland's commitment to family caregivers by developing a person-centered approach to caregiving support that spans statewide and regional resources. This unique structure bolsters the resilience and dedication of all Maryland caregivers, ensuring they have the resources needed to sustain their critical role across the lifespan. If you want me to read the strategies we identified, they are: increase awareness of national family caregiver programs, services, and their vital economic impact. Enhancing Maryland Access Point to support informal family caregivers and promote economic opportunity. Adopting elements from two impactful national strategies, the Together in Care Initiative by PHI and the 2022 National Strategy to Support Family Caregivers by the Administration for Community Living. Number 4, strengthen partnerships, assess needs, and expand funding to enhance respite services. Number 5, support Senate Bill 202, advancing financial relief for family caregivers. And number 6, expanding economic opportunities for family caregivers through statewide training initiatives. And those are our strategies. Any questions? Okay. Looks like Claudia Balog raised her hand. Go ahead, Claudia.
Hi, thanks. Teresa, that's really great. I was curious, in your conversations, did other state models of of family of compensation for family caregivers ever come up? For example, like CDPAP in New York or Washington states statewide PCA program. I'm just curious, sort of like, because a lot of these are sort of like the big picture sort of themes. I'm just curious in the group if there were any sort of states that you were looking at as a model for Maryland.
The only state I remember discussing was Minnesota.
Mhm.
No, we didn't go that deep. We didn't discuss those other states. I'd like to get more information about it, though. I don't know. I'm sure that'll come up at maybe the next round.
Yeah, and PHI is certainly like delved into some of that sort of thinking about, family caregivers as a segment of the workforce, and sort of thinking bigger than like, how do we financially support folks, but how do we acknowledge family caregiving as in many ways a career path, right? Because you noted the training, right? I think that from the workforce perspective, there's actually a clear pipeline from family caregiving to discovering that you are actually like, this is your calling, and this is what you want to continue doing. And how do we provide resources for folks who have sort of learned that they have a career pathway from their experience as family caregivers. So
I
thanks.
don't know if our intention if that was the thought process, that they would transition from being an informal family caregiver to a career as a professional family caregiver. The thinking is that as an informal family caregiver, the more training that they have, the more training we have, the better we can be at the work that we have to do as we're caring for our loved one. The less burnout we'll have, the more empowered we'll feel when we're advocating on their behalf. And the truth is there's a lot of, you end up in this role with not a lot of experience.
Right.
Well, most people do for the first time, without a lot of experience, and overwhelmed and not able to actually go out and get it. So if we can find a way to get training into the hands of family caregivers, it benefits everyone.
Yep. Thank you.
I'm passing it back to you, Julie.
Thank you, Teresa. I was wondering, I know you guys had a bunch of some really helpful information sort of digging into the strategies.
Right.
Do you want to maybe talk about a little bit of some of the key actions that you shared?
Let's take a look. Are there any in particular? Because there's a lot here.
Yeah.
So
I was trying to think if there was anything within the training that speaks to Claudia, the training strategy that speaks in particular to Claudia's point. Enhanced employability and skill development. I think maybe there's.
Okay, so I see where she would get that thinking from. There is a pathway in the caregiving industry that's not necessarily professional family caregiving that can benefit informal family caregivers. And of course, if someone may discover they have a call, right, and decide to become a professional family caregiver, but there's also caregiving consulting, caregiving coaches. There's a lot of different pathways in the caregiving industry that a caregiver may find themselves in. For example, I'm a former family caregiver, and now I do more public speaking on issues related to family caregiving. And so that's something I never thought I would do. And so again, working with family caregivers, giving them access to training may lead to all sorts of different opportunities that can help them not only advance their skill, their ability to cope, their ability to care for their loved one, but may help them to earn income or help them and they may decide to go on a different path. It depends. I don't know if that helps or if that made the conversation more complicated. I see someone has their hand raised. Monica?
Yes. So you led your discussion that you want this to be a person-centered approach. So so the person-centered meaning the caregiver is the, the object or the person who is going to be, valuing all of these things. Or, the person center sort of threw me off, and then you had all of these programs and training. So how does person centered fit into it? If I'm an individual caregiver, family caregiver.
I just attended a workshop over the weekend about creative engagement and caregiving, and they discussed how a lot of the training that's available mostly in nursing homes and facilities,
Institutions, right?
right, are not as person-centered or engaging as it should be. We talked about the importance of using creative engagement to help family caregivers connect with their caree in more person-centered ways. And so I think the idea of including the word person-centered in this objective is to remind us to stay focused on the person, that this is very personalized care that we're providing, and there's not going to be a one-size-fits-all approach. We need to look at all different types of wherever we can to try to find whatever resources we can to help these people. And I mean, that's my thinking behind using the word person-centered. I don't know if Ash has anything she wants to add, but the idea is that we need to make sure that whatever we do, that we keep that informal family caregiver in mind.
I just think that might throw people off. That's sort of an approach within all of these, but to make it as the objective, since I think all of our objectives were how do older adults have the opportunity to contribute to Maryland's economic engine, right? Or economic opportunity. So, I mean, it's just it sort of threw me out. I understand what you're saying, but then so all the training that they would get, you're saying, make sure it's person centered, right?
Well, we have seven strategies.
Okay.
That is just one part of one strategy. And so I don't think that, I don't know how to really respond to that question, your concern, except that whatever we decide to do with these strategies, we need to make sure that we remember that this is an individualized, person-centered approach, that these are individuals. It's not a corporation. These are not professional family caregivers, and that's our thinking behind that. I hope that helps in some way. And training is definitely from a lot of different areas. I remember going to Career One Stop during my caregiving experience to try to figure out what I could do to earn an income for my family, because my circumstances had changed so much. The path that I was on wasn't going to work for me. And so I do believe training is important. I do think it needs to be individualized. I think that, and I'm not an expert in any of this. Oh, it looks like someone else has their hand raised, and I'm hoping that Ash will chime in here. Bisma, go ahead.
Yeah, hi. I think by person, for example, in healthcare, we mostly think of patient-centered approach. So that might be the confusion here, because when we are talking about a patient care, and we are looking at different people involved, engaged in the care of the patient. So family support is a relatively newer concept because it is taken for granted, right? So for you, Monica, I think what you, I may be wrong, but what you think try to meant, maybe you are trying to meant was tailored, as you mentioned just a few minutes ago, the tailored approach. Like, for example, you said if somebody is a single person taking care of other person, their education, their finances, their individualized circumstances approach, not a professional type one size fits all like thing, but you know specifically related to the specific circumstances that individual caretaker is going through or will be going through. For example, it may be mental stress, it may be they are arthritic by, for example, if it is a spouse, or maybe they're a child and they needed some focused approach, right?
Yeah, I just, I just, how, maybe I'm just a little, person centered so that every individual gets a, a different kind of approach.
Exactly.
But I don't know if that's what you really mean.
Mhm.
So it just was, now I understand what you're trying, and I'm trying to come up with something, that that would better articulate my point, but maybe Kathy has her hand raised.
Well, I was kind of taking it as an a la carte approach. You go for the
Yeah.
services and support and training that you need. And I do like Teresa's mentioning that, she went to the one stop to get additional training for other things, because so many caregivers do give up a significant amount of their work life at a critical time and have a very hard time coming back into the workforce. Moms who stay home to take care of special needs children, older adults who are taking care of their parents. So having those supports and that individual services, not just teaching them caregiving, but giving them other options to re-enter other training and skills that they can work with simultaneously to come back into the workforce when they need to, because the financial burdens of caregiving continue and they are disproportionately affect women of menopause age. So, hey, yay. But I do like the a la carte approach idea that each person will need different services and supports depending on their unique needs and finances and what they're struggling with at home.
Mhm.
Well
Other-
said, Kathy.
Is the word using a person-centered approach rather than developing? Because you're going to be aggregating, resources and all this, but yet you're, in evaluating them, in developing new ones, you're going to make sure that you're going to use a person-centered approach. Maybe, but, I could be off because I'm not, in this field.
Now, Nancy Gunt, I don't know if I'm saying your last name properly. I apologize. She wrote, "Yes, I agree. The driving principle of person-centered approach in supporting the caregiver comes across here." That was
Okay.
her response in the chat.
Right?
But thank you, Monica. And it's not the end of this conversation, right? Julia can attest to that. I believe there are more meetings to come, more town halls in the new year where we'll flesh more of this out. Thank you, Monica and Kathy and Bismarck.
Nancy, did you want to say anything?
No, not at this point. I think yeah, Teresa and Kathy and Bisma pretty much shared, what I would say. I think wordsmithing, changing, developing to using is something that might happen in the future. And I understand I'm coming into this process a little bit late, but person-centered approach where the person is the caregiver, I think is the important point that it seems like is being made here.
And that was actually the clarifying question I have, is that we're talking about the caregiver in terms of person-centered. We're talking about the caregiver rather than the people that they are caring for.
Correct.
Okay, thank you.
That makes it clear.
Caregiver.
Centered approach. Well, the stronger the caregiver, the stronger the care. The more supported the caregiver, the better the care.
Any other thoughts? All right. Well, thank you, Teresa, for sharing and for taking the lead on the group and the recommendations. I don't think that Maywish is here today, and that might be why she hasn't chimed in. But it sounds like she helped significantly in terms of building these out as well. Kathy?
Yeah. Okay. Do you want, I still have ours in the red. So do you?
I tried to, we started sort of
I-
compiling I didn't end up sharing them because I know we're all sort of, the things are still being pulled together.
We're still fleshing it out, and we have such a big team that I'd like to get input, make sure that we're all on the same page. But so our recommended objectives, there's two, because we have one for 50 plus and one for intergenerational workforces. So I hope I'm reading the right document. Increase the number of age-inclusive employers who have dedicated policies, practices to employ, retain, and advance older workers, and initiatives to promote sustainable career opportunities, pathways within a multi-generational workforce. The recommended adaptation, increase the number of employers operating in Maryland that promote sustainable career opportunities across generations using age-inclusive policies and practice. And then the second was to address the responsiveness of Maryland's workforce systems to increase employment success of older workers within a multi-generational workforce. So the first one is more focused on employers. The second is more focused on the workers. The recommended adaptation, improve employment outcomes of older workers using multi-generational lens by increasing the responsiveness of Maryland workforce infrastructure. So let me go to our strategies. Our strategies by 2026 establish a baseline data by industry sectors on the number of age-inclusive employers in Maryland who can share success narratives and existing state, county, and local initiatives, models, and policies prioritizing older adult employment. Next, we have by 2028, the state government should apply for Age-Friendly Institute Certificate, Age-Friendly Employment CAFE Certificate, or something similar, and lead the effort to encourage Maryland employers to adopt age-inclusive policies and practice, include representation from culturally diverse and traditionally underserved populations, LGBTQ, veterans, ability challenged, and of course, youngers. I'm throwing in a few words. By 2028, develop a resource repository of educational opportunities for employers to learn about actionable strategies for creating age-inclusive workplaces and addressing challenges older workers experience. By 2029, conduct a statewide outreach and marketing campaign with input using an intergenerational lens to increase Maryland employee awareness of economic engines provided by the aging labor workforce, the business case for age-inclusive workforces, and to promote the age-inclusive employer certification and resources. By 2030, I have to drop a bit. Formal partnerships between employers and industries who commit to hiring older workers with the MWE, the Workforce Development Boards, POAC, and other workforce service providers. By 2025, conduct the first statewide reverse job fair between certified age-friendly employers with talent shortages and job seekers who have received training on working in a multi-generational workforce. I actually had a question on that one. By 2035, establish a state agency repository for collecting and reviewing the data on numbers of employers who achieve certification and those awaiting certification. And By 2035, create a financial incentive, tax incentive, state subsidiaries, applications, memberships to CAFE network to increase the number of certified age-friendly employers. And do you want me to read the support, or do you want me to drop down to the strategies?
What do we want to? Well,
That was for the first objective, which was increase the number of age-inclusive employers with dedicated policies and practices to employ, retain, and advance older workers and initiatives that promote sustainable career opportunities and pathways within a multi-generational workforce.
I think for the time being, let's skip over the supporting information. That said,
Okay.
I'm taking some notes based on the comments for additional things we can throw in, but if anybody has thoughts about potential partnerships and some of the other information, they should feel free to share. One thing I will ask Kathy, though, is do you mind, for those that are not familiar with some of these acronyms, MWE and POAC?
Oh, okay. Sorry. MWE is Maryland Workforce Exchange, which is a statewide program of job postings where all job seekers can go to find jobs, and then it's tracked through the state system. POAC is Professional Something Outplacement Center, which helps professionals return to the job market. I think we probably should add a bit about SHRM, the Society of Human Resource Management. We should probably include them on that as a source to, or involve them somehow, because we don't mention SHRM in here. And is there other initials I'm missing? I'm trying to think if we have a lot of writing.
I think you got all of
Oh,
them.
and there was CAFE. I looked it up and I have to, is the certified age-friendly employer is a CAFE. Are there questions or comments, or would you like me to go on to the next objective, which is focused on the employee? Maybe I'll go on to the employee, because then you know that we have addressed, it doesn't seem like we're missing something in the employer and when we have it in the employee. So I'll just jump ahead. Let's see. So, I don't know why it's doing this. Okay, so under the second objective, which is address the responsiveness of Maryland workforce systems to increase employment success of older workers within a multi-generational workforce by establishing a Maryland state government as an age-friendly employer. I think we need to expand that a little bit too. Improve older workers' access to workforce support and successful employment outcomes. By 2027, establish a lead state agency to develop an ongoing process for collecting and analyzing data of older workers. That's similar to the first one. We just don't have any data to really even base success or where we need to focus on. Secondly, implement an enrollment goal to ensure proportional number of older workers are receiving the services compared to the unemployment rate of the segment of the population. So are older workers receiving the same amount of services? I believe in WIOA, they actually are, but I don't know about the other ones. By 2030, develop a reporting and evaluation process to improve coordination and collaboration across adult service programs and systems to ensure sufficient staff capacity and cultural competence services are being provided to older workers seeking employment. By 2032, an intergenerational collaborative with adult education, universities, and entrepreneurial intervention centers to prioritize the training, upskilling, and reskilling of older workers. By 2035, develop, earn, and learn internships, apprenticeship programs, returnships, opportunities in high-demand industries and market to older workers. I think we should also add age-friendly industries, high-demand age-friendly industries. By 2035, develop and test innovative career pathways, phased retirement, job sharing, bio-directional memberships, sabbaticals that are responsive to addressing employers' talent pipeline shortages and workers' needs for flexibility at various junctures in their work-life span. By 2035, establish a program with certification services, resources, and incentives for new small businesses owned by Marylanders who are over 50 and older that models the veteran-owned small business enterprise program and the minority business enterprise program. By 2035, strengthen age discrimination laws related to hiring, promotion, and layoffs. So there we go. That's a lot to take in. Comments, questions? I wish we could put it up, but it's got a lot of red on it, and we have a lot of text. Oh, excuse me one moment.
We still have a good bit in draft form, which is just reiterating is why we didn't send it out. But I wonder if I know the time is super tight, but so that everyone has sort of some time to digest this. I tried to consolidate the drafts that we have so far into one document. It's not the final version, but maybe we send that out, and if people would like, they can make comments and share some additional potential, some of the supporting information that we're looking for in terms of ideas around data sources and partners and those types of things. Kathy, you're on mute. Are you?
Sorry. We have a big team, and I'd like to make sure that our team has had a chance to really go over it. So I know if anybody's on the call, I'd love to get your input, make sure it truly reflects the team effort, and not just me and Monica. Although I'm a lot of fun and I'm pretty cute, so hey, just kidding. But I know there's a lot of ideas out there. So if we do that team, is that something you can give us some feedback in, or would like to give us some feedback in? Crickets. Okay. Well, I guess we can just print it up and send it out. Oh, Bisma, yay.
Yeah, hi. So it is fantastic. I mean, the work you guys have done, seriously, it is paramount. But but my question would be, I mean, my comment actually would be, I was looking at the timeline. And to me, it seems like there are a few things like, and I will write in details. I will send my feedback. Timeline seems a little bit too long for me. Like
it is a 10-year program. I mean, we are making a cultural shift. We are trying to change a lot of minds, and
Right.
it is going to take time, and we don't have some of the key data we need. And we're going to have to put some things in place before we really start to push the concepts. So it is, I mean, hopefully it won't take 10 years. Hopefully we can get it going sooner, but it is a 10-year plan. And we are asking to make some major cultural shifts and go against, the popular media that older workers are old and they're not data friendly, and they're hard to work with. And we're also a key part of this, and we've mentioned it a couple of times, and I think we really need to really focus on, we are focusing on an intergenerational workforce because we're all future old people, and we're born that way. So
That makes total sense. But would it be possible, like for example, for majority of public health programming or any other theory testing or model testing, we usually do pilot programming, pilot projects sometime, you know, and we take lessons learned or SWOT analysis and anything. So
Mhm.
would it be possible to implement like a small pilot project, and we can think about that pilot project like maybe anything we could start, and we can all brainstorm and give our feedback to have some shorter pilot project just to test the theory, the model we are trying to create.
And
the-
the more, and that's a really good point, because the more success we can show,
yeah,
then the more people will, we can show the business case that this is more effective, even though we have it in numbers. I think we need, anecdotes and stories to share, because that's what sticks. Stories stick.
yeah.
So yeah, we could, I'm okay with that. We can work on that and add in a test pilot, especially in the second objective where it's more, even employer based, but
Employer
based with the
yes, exactly.
any training
Yeah.
programs, upskilling in returnships would have to be, have to be tested out, because we need to make sure we're hitting the mark.
And I'm sure it is a much needed initiative, because aging is a fact, universal fact, just like life and death and all these things, and healthy aging and happy aging and all those factors. I'm up for all those ideas, and because this is the universal fact. So, and I'm sure it will succeed, the pilot project. There's no way it shouldn't be succeeding, helping people, trying to improve, trying to create an impact. So short-term pilot, it will be like seeing is believing, and everything, what comes with the pilot project. So I believe in, I would strongly suggest a pilot project.
Do we do a pilot before we really promote it, so that when we send Governor Moore out and say, okay, hire older people, here are the programs and here are the successes?
One way is, this is one way. The other way, my idea would be a pilot, parallel planning, like a pilot project is in plan, and we can start the short-term project of the, bigger picture, like what we are doing now, strategies and objectives. So while that is being developed and implemented and planning, because we don't have to wait for like 1 year or 2 years to see something to be successful, because it is not a medication like a discovery or health. You know what I'm trying to say. It's a harmless thing. It's not harmful thing. Like, we are not trying to develop some vaccine or some medication that wait for 2-3 years to see the disadvantages and this and harmful detrimental effects. We know that being in public health or healthcare, we understand that some things are bound to be successful, bound to happen, right? It's just a matter of time. And plus, seeing the models in other age-friendly states, we can definitely try to replicate those models with the same demographics, and then a short pilot project while the major planning is in progress. So parallel, something parallel in planning phase, in because for a project, we know that planning, development, lessons learned, first stage, second stage, we all see that we are a work in progress. Constantly we are trying to improve. For some projects, the product deliverables are at different phases, and we are still working.
Well, and I was just thinking, and we haven't discussed this, the assumption is that this will be funded and supported right out the gate from Governor Moore. Like, so, because right now I'm in the middle of grant funding, and I don't know if it's going to come, and I don't know what it's going to look like.
Right.
So that is a question that I think we need to circle back to. Some of these things are very expensive.
Mhm.
how do we fund like initiatives like returnships and training and a staff that, or support and training and train the trainers that go out, like those all need funding. Or even if we do a volunteer support system, we still need somebody to manage and train the volunteers.
Mhm.
So there are some costs associated with that, and we really haven't gotten
Yeah,
into the budget. We're still doing the wish list.
Right, right. No, I totally understand. But then again, you know, where there is a will, there is a way. We can start something. I mean, we can start thinking about it at least. When there's a willingness to think,
I'm absolutely agreeing with you. I'm just saying that we haven't addressed that. And what is our, are we going to get funded completely right off the bat, or is it going to come in increments? We don't know that. So that makes it a little harder to
no,
plan.
definitely there are so much uncertainty. But then again, Governor, I mean, he would be happy too. And if we are trying to do something within his term, you know, within his time frame. So something, you know, he would be definitely pleased. I'm just saying, you know, like, so when there is small something and it is successful and it will be an accomplishment for his tenure too, you know, like, okay, this is what my people have accomplished, you know, you guys, Department of Aging and everyone. So something, you know, at smaller, maybe we can have one employer, we can train some people. I know the sample size and maybe small, 10, 20, 15 people, we can train them, we can do this. And I will be happy to lend more time, you know, for training or for doing all this, you know, we could coordinate. And I'm sure there are so many people.
Would love it. I think I think those are great ideas. And I also,
I mean, it's a win-win situation for everybody,
Yeah.
all the stakeholders.
I think we also need to, and I didn't add it to the intergenerational, but we probably should put out training that comes prior to that 50, 55 cliff of, like, when people 40, 45 are starting to think, you know, getting the awareness out that you are hitting that kind of dangerous time where health goes, or menopause makes you loopy and you quit for no reason.
Oh my God, yes.
Or, you know, your construction, and all of a sudden that knee that was kind of clicky means you can't do construction. So I think there's also, in the intergenerational, we have to think future old, you know, we have to go back to, and I think we need to do that too. It's not just for 50 plus, it's preparing to be 50 plus.
Absolutely. Just like perimenopause, you know, I know the menopause, we are waiting for menopause, nobody tells you. And by going through perimenopause myself, I'm like, oh my God, I'm a physician, OBGYN, but I never knew these things until, you know, things happen to you, you know?
Oh my
So
God.
that's what I'm a big champion now for perimenopause. Actually, I'm thinking of starting my own coaching in perimenopause.
Oh
And
my
I've
God.
given so many lectures.
I'll have to tell you the funniest story when I had with 2 young SHRM HR recruiters at the bar one night. It was, it sounds like a bad joke, but it was a really funny story. So I'll tell you about it.
Oh, sure. Sure. I would love to hear that. Yeah, sure.
Anyway, now that we digressed.
It was just an idea. I mean, of course.
No, I know, but yeah, there's so much that hits the 50 plus worker that we could write but we need to start somewhere and figure out.
Yes, exactly.
Health challenges are
absolutely
something that push out the worker for 1, 2, 3 years, and then they have a gap. They're missing skills, and then they can't come. It is an uphill battle for those workers. So we see that time and time again in CSEP and in our upskill training.
Yeah.
So, okay. Well, we have a good weekend ahead of us, Bisma.
Okay.
Anyone else have some thoughts, ideas? I gotta look at the comments. Maybe. Okay, I didn't see anything in comments. Anybody else? Or we'll send it back. Julia or I will tighten it up and send it back out to the group for more feedback. I know it's a lot. And once you leave, you might have that aha moment.
I just wanted to say that let's see, the strategies under Objective 2 that are now there do not coordinate with the revised, strategies, or I guess what is it? Not strategies, supporting information. Sorry, those were from the original one, so they need
Well,
to.
we didn't read them anyway, so we'll go back and
Well,
do
no,
it.
but I'm just saying.
Yeah,
you
thank
know,
you.
for the next time.
Yeah. Teresa?
Yes, I'm sorry, I got a little distracted during your presentation, but did you mention anything about entrepreneurship?
I was just thinking we had talked about it. I got to go back and make sure. We talk about it at a high level. We mentioned entrepreneurship under the second objective. Let me find it.
Number 5.
Yeah, number 5 and number 7. Number 5 is develop, earn and learn internships, apprenticeship programs, returnship opportunities in high demand. And then 7 was the one where we mentioned it, but we don't talk about SCORE earlier. And that's another group group of Small Business Administration and SCORE should probably be involved in some of the other training earlier. Establish a program with certification, services, resources, incentives for new small businesses owned by Marylanders who are 50 and older that model the veteran-owned small business enterprise program and the minority business enterprise program. And I think we do need to go put it under as potential employers, because if people are starting small businesses, we tend to look at bigger companies, but small businesses also can start off, or new businesses can start off as age friendly.
Exactly.
Yeah. So we need to put that back in the first one too, to make sure it's represented there. And I didn't see SCORE. We do have some of that information on the drop downs. So, but we didn't read those, but we'll get that in there, because I think small businesses are really our golden opportunity to make, to bring tax base and growth in Maryland.
Mm-hmm. Okay.
Anybody else? Okay. Okay. Carolee, did you have something?
No, I'm sorry. I just wanted to say thank you for all of your hard work. I really didn't contribute very much to this discussion, but I appreciate and I've learned a lot. So I want to thank you all for all of your hard work and knowledge.
Oh, thank you. Monica did a lot of typing this week.
Did a lot more than typing.
Yeah. I think we're done, Julia.
Great. Thank you, Kathy. Appreciate your leadership as well. And Monica too, for hopping on that call earlier in the week to clarify things and really spend some time building things out to align better with the previous discussions. Chase sent me an email, and unfortunately she is having some IT issues. So I'm going to run through their objective. Is there anyone else from oh, great. Claudia, would you prefer to run through things? I'm happy to bring up the draft.
You could bring up the draft. I actually haven't seen where we landed. I made some edits to it like a week ago. So it'll sort of be as new to me as anyone, but I'm happy. Like the big picture stuff, I'm assuming stayed the same. So I'm happy to run
And
through
she said they're still collecting feedback from others. I will add one thing that Leslie had reached out to a few people. I'm not sure you are included on it, but since we are really since we're really limited on the number of objectives that we can recommend from the work group as a whole, we were chatting with the subgroup leads around having your second objective here, seeing if there's a possibility of folding it into objective 1 so that we're sticking to the 4.
Okay. To
But
my
we can
knowledge,
still-
I thought we only had 2 objectives, but
We have
but-
4 across the entire, across all of the subgroups.
Oh,
So
I
each
see.
subgroup
Okay.
was to have
Got it.
1, and then the employment for 50 plus and a multi-generational workforce has 2 because there are 2 priority areas combined.
got it.
Yeah.
Okay. Okay. Well, yeah, there are some overlaps, I think, but I'm happy to like kick it off. Like this is where we're headed. Okay, so our first recommended objective is that by 2030, the state create a mechanism to enhance wages and overall compensation that serves to boost recruitment and retention rates within the direct care workforce. And that would be presented at the state level. And I don't know if this is going to remain in the final doc, but we recommended enhancing wages to match a calculated living wage, for example, as determined by the MIT Living Wage Calculator. And our second recommended objective, which I think actually, now that I'm thinking about it, we can finesse into this. By 2030, the state will have the ability to track and collect workforce data such as wages, certifications, roles, and connect consumers such as families to direct care workers. So in the strategies for the first objective, we said that by 2029, we wanted to implement what's known as a wage pass-through, or a requirement that direct care workers receive a minimum percentage of Medicaid reimbursements. By 2028, we wanted the state to improve state oversight and employer compliance of minimum wage and overtime regulations on the direct care workforce. We want to increase cost reporting accuracy from organizations providing long-term services and supports, and ensure that resources are being spent on the care infrastructure. We also want to create a working group with robust worker participation, caregiver participation, to identify wage targets as required by the CMS Medicaid access rule. And I'm going to stop here with just an asterisk. Many of us on this work group had a concern that depending on the outcome of the election, the Medicaid access rule may be overturned, and many of our targets are based upon the Medicaid access rule. But I want to say that states across the country have done these things without the existence of a guidance from CMS. So we reference the Medicaid access rule in here. I am an example of the generation of sandwich caregivers before you. Hi, Samantha, mommy's talking. And she has walking pneumonia, so apologies. And then we want to increase innovative, accessible, and more comprehensive training opportunities for direct care workers. We also want to create open and flexible pathways that include career ladders and lattices into workforce with past lay experience credits, and enhance the re-entry point for past credentialed certified nursing assistants to the Maryland Board of Nursing. And this sort of touches upon some of the questions I was asking of Teresa, but just this idea of, you know, there's a lot of lay experience in caregiving, and how do we ensure we're tapping into that properly to support all of our efforts to recruit and retain caregivers and care workers. And I guess I'll skip all the supporting information. And I guess, like, if we're talking about objective 2, which is like an objective about data collection very specifically, we want to ensure the state has the ability to track, collect important data, and connect families to caregivers. So we want to create a working group that includes state partners and regulatory bodies and providers and direct care workers both agency-based and self-directed care workers to develop those data collection tools and determine, how often those things should be collected. We want to we want the state to undertake an environmental scan of current state registry systems and identify the data that's already available and examine the economic impact of the direct care workforce registry or platform on industries in Maryland. I'm trying to understand that one because that one got tweaked a little. Apologies. We want to leverage existing relationships with the Hilltop Institute and other stakeholders to collect this data, conduct analyses, and publicize findings. And we want the state to create a centralized dashboard online for this data. And then finally, we're hoping to develop a vehicle that facilitates an interconnected care system that includes providers, care recipients, families, and direct care workers. And on this piece, we really were looking at other states that have really innovative online platforms where, for example, so I type in my zip code and I have a family member who needs care and needs specific kind of care, culturally competent care, or a caregiver who speaks a specific language, or a caregiver who has experience with clients who have dementia. And there are states like Washington State where I can go into an online platform, type in those parameters, and the state would provide me a list of caregivers in my zip code or in the surrounding community who fit that description, so that we can really, again, sort of think about person-centered care, but think, sweetie, you got to stop. Think about person-centered care, but also like really ensure that that the state has an understanding of who direct care workers are, what their skills are, and how we best utilize them. So that's what we've got so far. This is Samantha.
I admire your ability to multitask.
Yeah.
Impressive. Thank you for reviewing that, Claudia. Does anyone have any reactions, any thoughts?
I had a question just on direct care worker, it'd be just because the group, again, I know that are low income is direct care workers tend to work at home, in homes, and there's not, and I don't know if this is part of that, but transportation can be tricky, like having access to transportation to work or being able to live in those places where the direct care support is needed, and having access to benefits like sick leave and vacation and tax. I don't know. I may have missed it, so I apologize.
It's not explicit in the document, but it is absolutely like part of the conversation when the CMS Medicaid access rule sort of speaks to it, like this idea of it's not just wages, right? It's like, what's the infrastructure and what are the conditions? What are the working conditions that are impeding our ability to retain caregivers? And direct care workers do include, by the way, both home and community-based centered workers and workers in congregate settings such as skilled nursing facilities. And it's a definition that's sort of emerging that comes out of PHI, which is really the premier national organization that looks at the direct care workforce as an entirety. But yeah, so like I think that it's an important piece, and it might be something we want to be explicit on. We were also sort of we had conversations that included ideas about transportation and housing and sort of like all of these other factors that we were trying to grapple with, but like, what can we control? Like, what could the state password? Sweetie, stop. What could the state? What are we asking? What are we asking the state to do that's in our purview? That's in the parameters of like what we can accomplish. We can't necessarily bring down housing costs. We can certainly do innovative things like provide better transit assistance to workers. And there are actually states that are piloting those exact programs, like piloting the use of transit vouchers or even like Uber or taxi companies to get workers to underserved areas or rural areas. Yeah, so I think I actually like want to sit on that and think about how we could sort of expand the idea of just compensation.
I mean, we had a healthcare company, which was a nonprofit, reach out and wanted to use CSEPers to send out. So I think and then I know some are 1099s. Like there's a lot of shenanigans that go on with some of these less reputable. It would be nice to figure out how to create whatever that baseline standard is. And I know they say they get into pricing, but I think it's got it. Other places can do it. But, you know, the quality of people, the standard recruiting, I was shocked that somebody would want to send out a CSEPer. And I'm like, well, often CSEPers don't have cars.
Right.
And they don't have the physicality to do that. And you're putting a non-professional into a professional. I was a little shocked. So if anybody wants to know that company off camera, I will.
I would be curious to hear. I mean, I think
know
the 1099 issue has we have just started to address the rampant 1099 issue in the legislature. The state is now being very clear with agency providers that if you are categorizing your employees as 1099, you are not eligible for Medicaid funding. And there are questions about the enforcement of that. Our state's Medicaid agency is actually thinking about like, well, how do we actually make this enforceable? And I think some of what you're saying is also reflected in our strategies of like better data collection. Like we need cost reports, right? We need like providers to be providing data, and we need wage data from providers that is very clear, because there are variations depending on the provider. There are great providers. There are like really great providers. And then there are providers who aren't necessarily, who aren't paying overtime, or who aren't, necessarily doing the right thing, or who are misclassifying their workers.
They're not
right?
paying
So
time between when scheduled. Yeah, because these people end up in CSEP, and that's how I hear the stories.
yeah.
So, okay. Wow, everybody's done a lot of work.
I just want to give the shout out to Cheney and Cheney Fabius and Meg Laporte and Chase. Like they're like, I was in the meetings for this document, and I, helped contribute ideas along with a lot of other folks. We had a big group, but they really have been driving sort of our direction on like how we can distill this into a more general recommendation about the direct care workforce. So just want to shout them out.
Pausing just in case any other thoughts come to mind.
And just to Nancy's comment in the chat that I'm seeing, one thing I'd love to say is that a lot of our ideas are cribbed from other states. Like we really we're looking to see where we want to be ambitious, but we also want to be realistic and like provide a roadmap for things that we think are achievable. And a lot of the things laid out in this document exist in other states. And my personal 2 cents is that because Maryland has such a unique healthcare financing system, like Maryland is already a visionary in its healthcare delivery. So it makes perfect sense for us to like start thinking outside of the box on our long-term care delivery system. So just wanted to say that.
Thank you. I think it's fabulous. I'm relatively new to Maryland from New York, so it's great to be a part of this. Thanks.
Okay. Well, thank you to everyone for being a part of this work group, and for all of the time you spent, thinking on these recommendations and in the brainstorming in the meetings. We sincerely appreciate everything you've brought to this initiative. After this meeting, what I'm going to do is take the drafts that we have and update having them all in one document so that you all can see it. Just reiterating, it is not the final draft. It's just what we have to this point. But it'll be one final opportunity to share any thoughts that linger after the meeting and maybe come to mind that you didn't have an opportunity to share here. I will say in the 50 plus employment subgroup heard this from those leading the larger LRM initiative. We did, because of the executive order, we do have a very hard stop at November 15th. So unfortunately, there will not be, we won't have time to continue finessing these in this capacity beyond that point. So please be sure to try to get any final thoughts in before then. And then we'll follow up in terms of that opportunity to come back together. I believe it's January, but it's sort of tentative. Any final thoughts from anyone? Okay, and just a thank you to Jonathan, to JJ for helping us manage all of the tech throughout all of these meetings. Okay, well, I hope you all have a good rest of your day and weekend. We'll be in touch via email.
Thank you.